We're here at Shenandoah Valley Implant Institute. It's in the medical complex near IHOP off of University Boulevard in Harrisonburg. Let's go in and meet Dr. Stephen Saunders and Dr. Victor Saunders of Shenandoah Valley Implant Institute. They specialize in dental implants. Well, I'm now in the patient chair talking to Dr. Vic Saunders. If I was actually a patient having a consult because I have a broken tooth or I've lost a tooth, talk about what you would be telling me.
We now have the ability to place an implant, take an impression, and make the tooth, and later the same day put that tooth on so that you leave with the tooth. And so a process that at one time could take up to 6 months to complete, we now have you going out with a good looking tooth the same day.
And you can do that because you have a lab on site?
That's correct.
And that would be a temporary tooth, but it would look very much like my own teeth, so I could be confident cosmetically if I've lost my front tooth or broken my front tooth?
Precisely.
So I leave, I come back later that day, get the temporary tooth, feels natural, looks natural. Then how long does it take? When do I come back and get the permanent implant?
Generally, we'll let the healing mature for 3 months before we put the permanent crown on. But a lot of times somebody's so comfortable and happy with that, I have to motivate them to move forward.
Isn't that amazing? So if somebody has had some sort of trauma to their mouth, nobody wants to go around with a tooth that shows missing. So that's a huge deal.
Exactly. Interesting little tidbit of how we went into that was a lady came in, front tooth broken, and her wedding was the next week. And so we threw caution to the wind, and it worked out even better. And then the scientific research backs up this approach.
And how many implants have you guys done?
We've been doing them for 30 years now and have over 10,000 in. So
that's just amazing.
The feel-like part of it is something that a lot of people are interested in. They're concerned, what's this going to feel like? There's no reason they can't get that done and then go on with their normal daily routine. Very little soreness at all.
Wow. Well, we know that we also want to take a look at their lab and also talk to Dr. Stephen Saunders.
Thank you so much for being here.
Thank you. We're here now with Dr. Stephen Saunders. Dr. Steve, tell me how, besides having a lab on site, that you were able to do these procedures with so little downtime and so quickly.
Well, it's a combination or in addition to the office of some very high-tech equipment. And we have a CAT scan on site. So we can make a 45-second CAT scan that gives us a three-dimensional image of a patient's jaw. With that, we can take that data and transfer it to a computer program, and we can virtually place implants with that particular patient's bony housing. And with that material, we send it to a biomedical engineer. He then studies the position of the implants that we've placed and verifies that that's the most ideal support.
And all of this happens in hours?
Well, the planning doesn't happen in an hour. The actual procedure happens in a few hours. But once we get that back, we can email it and we get a surgical stent. And with that, we no longer have to open the gum tissues to place implants. We can use this guide that has stops so that we can go directly through there. And with that, the lab can retro make teeth that we can put on those at the same time the implants are put in.
So it's all of this high tech that keeps the cutting and all of that to
very minimal, virtually none.
Now, can a patient come directly to you?
Absolutely. We see a good many patients that come directly to us. People who have missing teeth or have traumatized a tooth. And we have, the Shenandoah Valley has a tremendous base of excellent dentists. And most of our people are referred by their general dentist.
So people can actually ask their general dentist to refer them to you if they have a problem?
Absolutely. And we work in concert with their general dentist as far as treatment.
And what percentage of your patients come to you because they've broken a tooth or trauma, and what percentage are periodontal, they have diseased gums?
My best guess would be around about 50-50. And probably a little bit more towards the loose teeth with the gum issues.
And you have lasers that can actually treat periodontal disease, right?
That's been the greatest addition to periodontal treatment in 30 years as far as I'm concerned. Because the procedures that were conventional involved cutting, sewing, resective procedures. The laser is strictly non-invasive and it is no downtime. The patient gets up, goes back to work, no post-operative discomfort, and it's regenerative rather than resective in nature.
Well, and another good thing is I guess you keep a lot of patients out of dentures that they would ultimately go to.
A great many, yep. I have some patients 32 years that were sent to me at that time thinking they were going to lose their teeth. And with regular maintenance and the appropriate periodontal treatment, they still to this day have their teeth.
That's
so
amazing.
It's kind of neat to see people that I saw 30-some years ago.
That's great.
Time
Thank you.
flies.
Thank you so much.
You're welcome.
When you have a bad tooth, you can't get away from the pain. After you've dealt with just about every procedure there is out there, just to have the pain go away is a wonderful thing. When you put the implant in, it was like I never lost a tooth at all. I have passed this story along to a lot of people because I think they need to hear it before they go through what I went through that changed my life. They're very well trained, they have the latest technology, and have been doing implants longer than anybody in the state of Virginia. So if you need an implant, this is where you need to be.